Okay, so endocrine disorder drugs. So endocrine glands deposit hormones in blood and transported to organs. The hormones help maintain homeostasis by regulating body functions, and are controlled themselves by a feedback system. So the pituitary gland, thyroid gland, parathyroid, pancreas, adrenal glands, gonads, and placenta. Okay. Drugs that affect the endocrine system include hormones secreted by the glands, synthetic hormone agonists and antagonists, and substances that influence the synthesis and secretion of hormones. So we've got hormones, pituitary hormones. And the pituitary gland, the master gland, is the small gland at the base of the brain. It secretes peptide hormones that regulate the thyroid, adrenal, sex glands, kidney, uterus, and growth hormones. The pituitary deficiency or hypopituitarism is the decreased metabolism, dwarfism, diabetes, insipidus, hypothyroidism, Addison's disease, loss of pigmentation, and thinning, softening of the skin, decreased libido, and retarded dental development. So hypersecretion, the sexual precocity, I guess it causes hyperprecocity, goiter, Cushing's disease, acromegaly, and giantism. It says 2 lobes, but I believe she means 2 lobes. I'm not positive. Yes, she does. I'm sure she does. So there are 2 lobes. The anterior secretes somatotropin, growth hormones, luteinizing hormones, LH, follicle stimulating hormones, FSH, thyroid stimulating hormones, TSH, or thyrotropin adrenocorticotropic hormones, ACTH, or corticotropin and prolactin. The uses include child growth, weightlifters, bodybuilders, and they build muscle, used for infertility and ovulation. Bromocriptine, ergo derivative that inhibits pituitary function, dopamine agonist, and suppresses prolactin. Uses include prolactin secreting adenomas, acromegaly, and Parkinson's disease. So then the posterior lobe secretes 2 hormones, vasopressin and oxytocin. Vasopressin is a vasopressor and antidiuretic. It's used for transient insipidus diabetes, clotting disorders, and oxytocin induces labor and controls postpartum hemorrhage and induces postpartum lactation. Thyroid hormones are important for energy metabolism and development of triiodothyronine or T3, iodine-containing hormones, tetraiodothyronine T4, thyroxine, iodine-containing hormone. Calcitonin regulates calcium metabolism. When there's dysfunction, there's vulnerability to stress, altered drug response, altered orofacial development. So iodine, approximately 50 to 125 milligrams of iodine a day is needed for thyroid to function normally. If not, TSH is secreted in excess in the thyroid hypertrophies. It's called simple goiter or non-toxic goiter. Good sources of iodine is marine life and iodized salt. Sometimes they use an antithyroid drug. See below. So, hypothyroidism, myxedema, or simple hypothyroidism, cretinism in children. Decreased thyroid function in a child is cretinism. Decreased thyroid function in an adult is myxedema, or simple hypothyroidism. The symptoms include drowsiness, weak, listless, expressionless, puffy face. I can never say this word. Edematous tongue and lips, difficulties withstanding stress, sensitive to all CNS depressants such as opioids, sedatives. Dose may need to be reduced. Oral findings in children. There's delayed tooth eruption, malocclusion, tendency for periodontal disease, poorly shaped teeth and caries, gingiva inflamed, pale, and enlarged. The treatment includes oral administration of exogenous thyroid hormones such as levothyroxine. And then hyperthyroidism, like in Graves, Plummer, or Hashimoto's. So Graves and Plummer's, diffusely enlarged, highly vascular thyroid gland causes hyperfunction. Hashimoto's is a chronic inflammation of the thyroid. It causes symptoms of hyperthyroidism, but causes the gland to be enlarged. It's an autoimmune disease, common in middle-aged women, and produces hypofunction. Excess circulating thyrotoxicosis. The symptoms include excessive production of heat, increased sympathetic activity, neuromuscular activity, and sensitivity to pain, eye diseases, protruding eyes, and anxiety. Some oral effects include accelerated tooth eruption, marked loss of alveolar bone, diffuse demineralization of the bone, rapid progression of periodontal disease. And epinephrine is relatively contraindicated in patients with hyperthyroidism. It can cause cardiac problems such as angina, arrhythmias, hypertension, increased tolerance to CNS depressants, and they may require higher doses of sedatives, analgesics, and local anesthetics. Obtain medical clearance before treatment for visible goiter or are on antithyroid medications. A surgical procedure or acute oral infection could precipitate a hyperthyroid crisis or thyroid storm. Wow, that sounds frightening. Thyroid storm. Treatment of thyroid storm, which is life-threatening, includes IV hydrocortisone, cold towels placed on the patient. Avoid epinephrine in controlled or poorly controlled hyperthyroid conditions. Treatment of hyperthyroidism. Drugs include iodine, antithyroid drugs, radioactive iodine, partial thyroidectomy. So thyroid and antithyroid agents, you can see them in box 19.1 in the book. But some include antithyroid agents, I guess, are given long term to treat hyperthyroid and also for thyroidectomy to reduce the risk of a thyroid storm. PTU, also known as propylthiouracil or tapazole. And drugs interfere with synthesis of thyroid hormones. Adverse reactions include fever, skin rash, leukopenia, granulocytosis. It leads to poor healing, oral ulcers, necrotic lesions, oral infections, paresthesia of the face, and loss of taste. So female sex hormones are secreted by the ovaries, testes, and placenta. They're responsible for female sex characteristics, the development of reproductive systems, preparing the reproductive system for conception. Estrogens are used for contraception, menstrual disturbances, osteoporosis, atrophic vaginitis, That sounds terribly disgusting. Non-development of ovaries, hirsutism, cancer, menopausal symptoms. Effect on oral tissues, puberty gingivitis, pregnancy gingivitis, desquamative gingivitis after menopause. Progestins promote secretory changes in endometrium and prepares the uterus for implantation of the fertilized ovum. Depo-Provera, Micronor, mini pills, IUD, used for contraception, postmenopausal women, endometriosis, dysmenorrhea, dysfunctional uterine bleeding, and premenstrual tension. Dental considerations for hormone contraceptives: increased risk for postoperative dry socket, chloasma, tan or dark skin discoloration, or melasma, increased susceptibility to candida organisms, so check the oral cavity and check after antibiotics, decreased glucose tolerance, check levels if needed, increased thromboembolic disease, long appointments, you need to give them a break because of this. Antibiotics may make the contraceptive less effective, so you need to take